Welcome back to Living Out Loud. I'm Susan Karp, the Executive Director of the Arlington Council on Aging, and once again have Mark Waxmonsky, the Council on Aging nurse, joining us today. Today we have an interesting topic, and I would like to start that many times we're going to be presenting material for information, so we do not necessarily take a position on one thing or the other. I think it'll be clear when we do. So today's topic is marijuana. I will turn the entire program over to Mark. So Mark, have at it.
Thank you for inviting me. And as Susan mentioned, this topic, this presentation is really just to educate the audience about the facts of medical marijuana, because as we know, it's a hot topic in the United States, Massachusetts in general. Legalization, medical marijuana, what's it all mean? Should I do it? Should I not do it? Really just kind of presenting what the basic facts are so that you can speak with your doctor and make a more informed decision and go through the appropriate channels to do so when that point comes. So medical marijuana, some basic facts, it means using the whole unprocessed plant or basic extracts to treat disease or the symptoms. And we need to know that medical marijuana is not recognized by the FDA. It's not FDA approved to really treat anything. There are, however, 2 FDA approved medical marijuana chemical-based medications. One of them is to stimulate appetite. The other one never really even heard of. I don't even know what it does, but there's 2 different types out there. So again, why is it not FDA approved? Because the benefits do not outweigh the risks. There's not enough studies to show that using marijuana on a regular basis will treat disease and have a more beneficial effect than it would mitigate the risks. So the balance of benefits versus risk is far exceeds the risk portion of it. We should know that our body produces the same type of chemicals that marijuana has in it, the compound, and I'll talk about those compounds in a second. And these chemicals help regulate our pleasure centers in the brain, memory and thinking, concentration, appetite, pain regulation, and regulating our senses as well. So folks, when they're using marijuana, 3 types of ways to ingest it. One is to smoke it. So smoking the product using a paraphernalia, it's quickly absorbed, it's actually less potent. And then folks consume what are called edibles, which is the marijuana baked into some type of product, some type of food product where it's subsequently ingested by mouth. And this form it's more slowly absorbed, but it's far more potent. And individuals oftentimes eat too much edibles because they think it's not working, they take more, and it can lead to some adverse issues. And then there's a suppository format as well. So the marijuana compound is placed in a suppository format and goes up in the suppository way. And the special methods to prepare like that. And that has the highest potency because of the area of the body where that is absorbed. We absorb a lot of it. So some basic facts, again, uses. I talked about those 2 chemicals, and they have a type of neurotransmitter effect. So neurotransmitters are chemicals in our brain that produce a response in our cells in our brain to do something in our body. So the 2 chemicals are THC and CBD. Those are acronyms. I'm not going to try to pronounce those here today, but THC helps to decrease pain, can decrease inflammation, and can control muscle problems. CBD can reduce pain, inflammation. Studies are showing that it may be helpful for controlling seizures, and CBD also may help to treat mental illness and addiction issues as well, which seems odd if you're giving marijuana to help treat an addiction issue, but there are other medications out there that medical marijuana may be better for treating some addiction issues. So what are some basic facts, the short-term, long-term effects of using marijuana? So it alters your senses, brighter colors, noise sensitivities. Folks get a euphoric feeling, almost like a high, quote-unquote. An altered sense of time. Sometimes people report that time slows, which makes things sometimes interesting. Changes in mood, again, that euphoric feeling. Sometimes folks feel giddy and find things overly funny. Impaired body movement, difficulty with cognition, so I don't think people are doing math problems if they're using marijuana. Impaired memory and then long-term effects are continuing to be studied. Some of the research has shown that individuals, if they use it at a younger age, may have development issues, memory issues, cognition issues. But studies are ongoing in how marijuana, medical marijuana specifically, is impacting seniors and their health. So more research is needed to identify those long-term effects. Some other effects, breathing problems, especially if you're smoking marijuana, and increased heart rate, again, if you're smoking. So for a senior, if we have cardiac issues, if we have respiratory issues, and we think marijuana, medical marijuana might be a good thing, smoking it's probably not the best way to use. Sometimes folks feel paranoid, which can make folks, when they're consuming medical marijuana, the paranoia can make folks really hesitant to leave the house, to be overly anxious, to have a higher quality of life because they're so impacted by the paranoid thoughts to do anything that would be beneficial. There are some parts of the country where where medical marijuana, or marijuana rather, is legal, increasing cases of psychosis, particularly around the edibles that we talked about before. So ingesting too much of the marijuana can make you go psychotic and lead you to a hospital where you'd be treated for those type of symptoms. And then the external effects of medical marijuana, so social conflict, if family members, friends don't think you should be using, that can cause tears in the fabric of that social relationship, and also impaired driving. So, like any other substance, it can alter your sensation and perception and ability and spatial perception to around the environment you're in, which could significantly impact your ability to drive. So why are we using medical marijuana, and what are we using it to treat, specifically the symptoms of cancer, glaucoma, HIV/AIDS, hepatitis C, ALS, Crohn's disease, Parkinson's disease, MS, or some other type of condition that you're debilitated by that your provider feels that medical marijuana could be a benefit for. So these are called quote-unquote debilitating medical conditions, and I'll talk in a second about what that means and how you can perhaps get a prescription for medical marijuana to treat these debilitating conditions. So as we may know, the State Department of Public Health regulates medical marijuana within the state at the moment, which means your physician has to be registered with the state in order to prescribe. Your physician must have a bona fide relationship with the patient and the doctor has to have the ability to assess you and understand your needs, and it can issue a written prescription. The patient, so you'd have to register yourself as well with that prescription with the state, pay fees, and do a couple of other documentation stuff, and then you'd have to get the marijuana from a licensed dispensary. So if someone has marijuana, it's probably not the best way to get that. You'd have to go through approved licensed facility. I'll talk about that in a second. Again, your physician will assess you, determine if you have a debilitating condition that medical marijuana might be helpful for you to have. So some cautions, especially if you're getting marijuana from unregulated sources. So right now in Massachusetts, there are several dispensaries located throughout the state. Again, these dispensaries are licensed, which means they have to go through the rigorous application process and controls and risk management stuff with the state in order to sell it to the public. One of those things is the removal of any harmful chemicals that you may be exposed to if you're getting the marijuana from an unapproved source. So there's insecticides, pesticides in marijuana, heavy metals as well, arsenic, lead, which can leach into the plant, which, as you ingest, you're exposed to that as well. Other harmful drugs, if we're getting from an unapproved source, sometimes the marijuana is laced with something else that can cause deleterious effects. And then other safety concerns with getting it from an unregulated source, safety in terms of physical safety and other nefarious things that can happen if we're not going to a licensed facility. So that's really kind of the conclusion of the medical marijuana talk. Again, it's not FDA approved. The personal benefits must outweigh the personal risks, which is determined by your doctor, and we need to get our product from a licensed facility. We need to be registered from the state to obtain it legally and use it legally at this point. That's my medical marijuana talk.
Wow, Mark, that was really interesting. Thank you. So again, this was presented for information only. The Council on Aging doesn't take any position, affirmative or not. What I find interesting though, Mark, so in order for an individual, so medical marijuana, it's considered pure. So that's the difference between what you get on the street, through your friends, through anything else. It's through a dispensary. So we're in Arlington. So do you know where the closest dispensary is?
So I know there's one in Salem. I think there's one up in Lowell. There's, I believe, one in Brockton. I think there's one in the western part of the state. Again, there are only several within the state right now. The application process is ongoing with other facilities getting on board within the state. And there's news that Arlington may have a dispensary coming here shortly. So I've got a lot of questions from seniors. What's coming here? Is it going to help me? What are the ins and outs of it? What do I need to know? Again, that's the kind of genesis of this talk.
So you yourself have been getting a number of inquiries from Arlington seniors about information as well as any health benefits. Now, Mark, you mentioned that we have an individual has to go to their doctor. Unless your doctor is already licensed to do so, you need to find the doctor that has the license in order to prescribe to come on the North Shore near me in Salem. So let me ask you this. Do you know how many physicians in and around Arlington, in case there's an Arlington senior that's wanting to pursue this?
I don't. That's a good question.
Okay.
And I'm not sure if there's a state website that shows who is.
Okay.
I guess you'd have to ask your own particular doctor if they have that ability to prescribe.
Okay. All right.
And that interest as well. Not every doctor is going to agree to prescribing it and may not ever get the license because they disagree with the treatment, whatever.
Right.
Some doctors may feel obviously the opposite. So.
Right. And I think, anytime that something doesn't have an FDA approval for a particular outcome on a particular disease, physicians, I think, would naturally tend to step back a little bit. But it is important to know that there are physicians out there. So if that's something that you want to pursue, you talk to your doctor first. From there, if you don't get a referral to a doctor that is licensed, perhaps we can dig around and look.
Right.
That would be Tag You're It. You'd have to do that.
Thank you.
As Mark indicated, based from an informational perspective, the benefit has to outweigh the risk, and that's a discussion between you and your doctor. That doesn't so. Is there any other thing that we can?
That's about it.
Pretty much it.
Yeah.
So, from an informational side, I want to thank you, Mark. I find that interesting.
Again, it's a new thing. We don't quite know the impact it's going to have, but a lot of folks do have questions about it because it's so new and it seems like quote unquote tides are changing of this type of alternative therapy.
Well, exactly, and whether you're watching a program on TV, and this is not to say that one program is better, whether it's a 60 Minutes, whether it's a Dateline, whether it's some other news break, there have been some commentary on the benefits of the particular chemical makeup of what is in that particular edible or. I was surprised on suppositories. I didn't know that was, I would imagine that would be for those that have a difficult time ingesting.
Yep. Or smoking.
Or smoking. So, that's interesting. So now you have a number of things to be looking at and discussing with your doctor. Always start with your doctor. It's not a diagnosis from your friends or family member. So continue to have that discussion to be in the best health you possibly can. So Mark, thank you very much.
Thank you.
Medical Marijuana 101.
Thanks.
All right, thank you. Thank you for joining us. We'll see you soon.